Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey and let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and health resources to help you and your loved ones plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, coworkers, and everyone you know to listen to the show, available on podcast apps worldwide. If you have a question or an idea for a future program, share your idea with me by commenting on my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. You can also complete my caregiver survey or request a consultation by going to my website, PamelaDWilson.com, clicking on the Contact Me button, and filling out my contact form. Welcome to episode 194 of the Caring Generation podcast in the Take 15 series, helpful tips and insights in about 15 minutes. This week, we're talking about navigating the health complications of aging. Studies confirm that about 50% of people aged 55 and older have 4 or 5 health conditions. So if you, your elderly parents, or someone you know are in this 50% or not in this 50%, stay with me. I will share tips to help you advocate for yourself or a loved one when health conditions stack up, because it is up to you and the patient to connect the dots. I also call this self-directing care. It's up to you to ensure that you receive the care you deserve from healthcare systems and doctors. In this podcast, I'll share the risks you want to be aware of within healthcare systems and providers so that you can avoid preventable care issues. If you enjoy research, a great source of information is the Health and Retirement Study and the 4,000 papers, articles, and studies created from data in this study. I'll place a link to the Health and Retirement Study in the transcript for this show that you can find on my website, PamelaDWilson.com. Look for episode 194. The Health and Retirement Study surveys people in America. It's managed by the University of Michigan and funded by the National Institute on Aging and the Social Security Administration. The study features information about common health conditions, health insurance, healthcare expenses, retirement, employment status, work history, family, housing, and more information about all of the participants in the study. Let's look at the most common healthcare conditions you or a loved one can learn to navigate. These conditions can result in daily difficulties if you don't learn about them and their consequences, because they can pose many complications in daily life related to your ability to work, enjoy retirement, and honestly feel good enough to get out of bed every day so that you can enjoy life. So you can choose to manage and understand your health conditions or have them derail your life and your dreams. The most common health conditions are heart disease, congestive heart failure, diabetes, arthritis, COPD, asthma, breathing issues, and cancer. Take these and then add a diagnosis of dementia or Alzheimer's disease, which in many cases happens at the same time. Dementia is general memory loss that can be related to any one of the health conditions I mentioned. Many times, dementia results from heart or circulatory disorders and diabetes, and any of these can result in a stroke. Dementia is also associated with neurological diseases like Parkinson's, Huntington's, multiple sclerosis, or ALS. Alzheimer's is a subset of dementia. Two other conditions common in older adults are falls and incontinence, which the healthcare system likes to call geriatric syndromes. If you or an aging parent has several of these chronic diseases, you are more likely to experience frequent falls and incontinence. In this case, the best plan you can make to navigate health conditions is to understand them by having a primary care physician and specialists to help you manage conditions for which your primary care physician lacks experience and expertise. The overall risks to be aware of and to plan for is that each doctor or specialist works only in their specialty or pays attention to the one condition causing the greatest problems at one moment in time. For example, a cardiologist manages heart disease. An endocrinologist manages diabetes. So, for example, a cardiologist may know nothing about dementia, diabetes, arthritis, or a hip condition. The risk for you as a patient or as a caregiver is that any one of these conditions can interact with another condition and the medications prescribed by a physician. The side effects of medications for older adults can be significant. Know your diagnosis and why you are being prescribed a particular medication, along with the potential side effects. Physician care can be disease-specific. It may not always consider the combination of multiple conditions a patient has because of a lot of limitations by health insurance plans, gaps in healthcare technology, and healthcare policies for treatment and billing. So it's not as if physicians purposely don't want to do a good job. They have to work within many rules and regulations of a very complicated healthcare system, which is why you, as a healthy person, as a person with health conditions, as a caregiver, must be very proactive in managing health conditions. It's important to know the risks you're dealing with so that you can avoid becoming an unfortunate healthcare statistics. The statistics I'm about to share are from the Agency for Healthcare Research and Quality. You will find a link to this information in the show transcript on my website, PamelaDWilson.com, episode 194. Here we go. Persons with multiple conditions result in 64% of all doctor visits, 70% of hospital stays, 83% of prescription costs, 71% of all healthcare spending, and 93% of all Medicare costs. These individuals experience more physical difficulties than healthy people. Women are more likely than men to have multiple co-occurring conditions. So the result for caregivers and persons with multiple conditions means going to the hospital more frequently and possible institutionalization, which means potentially living in a nursing home. I don't know anybody who wants to do that, me included. This description of what I'm describing to you is a description of fragmented care. The results are things like harmful medication interactions, potentially confusing recommendations from one physician to another who are unfamiliar with your multiple medical conditions, and these physicians may not talk to each other. There's also the possibility of duplicate or overlapping lab tests, and all of this results in higher patient costs and higher costs to the healthcare system. Add to this that research confirms that smoking increases the risk of developing multiple conditions, such as heart disease, diabetes, dementia, and depression. So as a caregiver, as the person who needs care, and as the healthy person today who may eventually interact with healthcare systems, it's important to know that doctors and healthcare systems are not yet at the point where managing more than one condition happens easily because of the methods by which they are paid or reimbursed. These don't support what's called whole person care. And so let me just share a quick story to make what I'm describing real. This story relates to care coordination and consultations between a primary care physician, orthopedic specialist, and orthopedic surgeon for one of my clients who I was the medical guardian for. This woman had heart conditions, she was slightly overweight, and she had dementia. She was living in an assisted living community where she fell and broke a hip. And so if you have a loved one who's broken a hip, you might know that there are several treatment options. An entire hip replacement, placing a pin, or no treatment. Each of these has different recovery options. In this case, unfortunately, the orthopedic surgeon had no familiarity with dementia, and he was probably placing my client in a category of age. So instead of a full hip replacement, my client got a pin, which meant that she could not be weight-bearing. She could not stand for 6 to 8 weeks. So my client with dementia forgot how to walk, in spite of many attempts after 8 weeks to do physical therapy. The surgeon, who thought he was really doing a good job, left my client wheelchair-bound, which eventually resulted in sores from sitting and eventual death. This is one example. There are thousands of physicians and specialists working only in their specialties, being limited by healthcare plans and not considering the other diagnosis of the patients they treat. Healthcare plans and their guidelines greatly influence treatment plans, which means that these plans place people in a certain age, into certain categories, and limit their treatment options so that they can reduce costs. Physician and health plan bias exists. This means that if you are healthier than most of your peers, doctors looking at your information on paper may ignore that and not give you a treatment that could help because you are in a category of 60-year-olds or 70-year-olds or 80-year-olds, which categorizes you as being old and feeble. Medicare and Medicaid guidelines and rules begin with the federal government and transfer to states. While there are many discussions about whole person care, which means looking at a person from all these health perspectives and diagnosis, it's going to be a long time before we arrive at standards for treating patients with multiple health conditions and having care coordinated between primary care physicians and specialists. Another gap in healthcare provision is electronic healthcare systems and records that I've talked about. A lot of these systems don't share patient records. Some systems refuse to do so. This is called information blocking. That makes it impossible for one doctor to see the total picture of a patient's healthcare needs and diagnosis. Again, if you're interested in more about this, there's a link in the show transcript 194 on my website. Other gaps that frustrate patients and caregivers are the transition of healthcare records after a hospitalization stay to assisted living communities, home health, hospice companies, and maybe even pharmacies. If you've ever struggled to get the care you need and you've been frustrated about why one doctor or healthcare facility does not have your information, the reason is this information gap between state healthcare policy, rules, and regulations. So instead of falling into this gap, it's up to you to make sure that you coordinate your healthcare records. Let's look at one more example. If a loved one is in the hospital, it's up to you to coordinate care after that hospitalization. Ensure that you're aware of medication changes, why the medications have been changed or added. Make a follow-up appointment with your loved one's primary care physician as soon as possible. If any type of home medical equipment or physical therapy was ordered, make sure you know the names of the companies where these orders were sent. Make sure you know what was ordered. It's easy for these orders from physicians at hospitals or nursing homes to become lost or delayed because of technicalities, incorrect medical coding, or missing documentation. Who suffers? The patient suffers, the caregiver suffers, and this can result in unnecessarily returning to the hospital. I don't know many people after a hospitalization who want to go back. So this means that you as the patient, as the family caregiver, must have a really good understanding of medical conditions, medications, and ongoing care in all cases. This means being clear about what it will take after a hospitalization in terms of effort, time, and treatments for a loved one to return to their previous level of abilities when they felt healthy. As I mentioned, age and the number of health conditions can significantly impact the care that you receive, recovery from illnesses or surgery. So when in doubt, advocate, ask questions about everything you don't understand so that you can become competent and comfortable navigating the health complications of aging. I thank you for listening this week. This episode 194, Navigating the Health Complications of Aging. The transcript is on my website at PamelaDWilson.com. Please share this podcast and information with everyone you know so that we can extend the support, education, advocacy, and love that so many caregivers and people with health problems need. I'm Pamela D. Wilson, a caregiving expert, advocate, and speaker. I look forward to being with you again soon. God bless you all, sending love and light to everyone. Sleep well tonight, have a fabulous day tomorrow, and enjoy each day until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.